Hey there. Today I want to go over this 2024 study published in the Journal of Exotic Pet Medicine. These researchers looked at 150 peripheral catheter placements in pet rabbits, comparing placement in the cephalic, lateral saphenous, and marginal ear veins. Now, if you trained in the US like me, you may have been told to avoid the ear veins because of the huge risk of complications like phlebitis or ear necrosis. This study kind of turns that on its head, and I've learned, being in practice over the years, that using the ear vein is not as scary as I was originally taught. So this study found that the cephalic vein had the highest failure rate at a whopping 59%. And these were experienced exotic animal veterinarians placing these catheters with a standardized protocol. The ear vein was found to be the most successful, with only 28% failure. And the middle ground was the lateral saphenous vein at about 35% failure. But get this, no matter who was placing the catheter and at what site, they had no major complications. No phlebitis, no ear necrosis, even in catheters left in for about 3 days. The most common complication they saw were bent catheters, at the elbow primarily, twisted or chewed IV lines, and early removal of the IV catheter by the patient themselves. A couple of things that they thought might have helped their success rates. They utilized small gauge polyurethane catheters, which were postulated to be a little bit less irritating. Each researcher was limited to only one stick per vein. So if the catheter failed, they redrew for another location to try the next catheter. And they also utilized varying levels of restraint based on the temperament of the rabbit, going from wide awake to sedated to full anesthesia for placement. Now, another 2022 study showed that topical anesthetic, or EMLA cream specifically, applied 60 minutes before catheter placement can increase your odds of success up to 10 times in awake rabbits. And I can tell you, I've utilized this in practice and it does really work, so I strongly recommend it. Even if you can't get it on for the full 60 minutes, I've seen effect at about 20 to 30 minutes as well. So the bottom line of this study is that the marginal ear vein in rabbits is a solid choice. We just want to avoid injecting anything irritating or anything perivascularly. So if you're not 100% sure that that catheter is in, it's probably best to remove it and replace somewhere else. Consider using a local anesthetic before your catheter placement. And don't be afraid not to use the cephalic.